Dr. Bill, there's a question for you.
Sure.
Okay, he said that can a person with cholesterol medication like simvastatin and libolin consume LIF, Gen 3, and STM?
Yes. And it's very good for people with those types of comorbidities. Anything related to blood pressure, cholesterol, or diabetes, those are the individuals that are more prone to heart attacks and strokes, which are the leading cause of death after the age of 40. So if you're taking medications already, it's even more important to be able to these other supplements, because they will often improve things significantly. Sometimes people can get off of their other types of medications, which sometimes have risk of side effects. A lot of times those other medications are essential, so I'm not trying to scare people, but I am a toxicologist, and I am aware of a lot of adverse effects with a lot of different medicines. And so if we can take supplements and things that naturally will decrease our blood pressure, cholesterol, insulin resistance, that's always ideal. So this does not have any interaction with any medications. Anybody with heart disease, you name it, autoimmune conditions, there are no medications that would be a contraindication to take any of the JIFU products. That includes Gen 3, that includes the Live product, the STM, or the Glow.
Okay. Thank you, Dr. Bill. Is there
Sure.
any other question from the audience? Oh, there's another question from maybe Dr. Henry Friendly. The question for Dr. Bill. One of the customer has arthritis, and she told them after taking Gen 3 the next morning she experienced pain in her whole body. What could possibly happen, and is it the effect of detoxification?
The first, she took Gen 3 and had pain the next day. I heard that part. But what was the first thing you said? Did you say she has arthritis? I couldn't hear the first part.
Yes, that is her sickness.
Well, I can't think of any reason why, if you had arthritis, first of all, Gen 3 is really excellent for that. I treat a lot of joint pain, and arthritis is a big reason why people have joint pain. But also the tendons, the collagen is extremely important for tendon health too. And a lot of times when people have pain in a joint, it's not arthritis that's causing pain, it's a tendonitis that's causing pain. So that's why collagen is really, really essential to joint health in particular. And since I do a lot of orthopedics, I'm always promoting the Gen 3. So I'm glad she was taking Gen 3, because that was a good thing to do if you have arthritis in particular. But I do not have a good explanation or reason why she would have increased pain the next day. I think the most likely explanation is that it was a coincidence and there was some other reason why she had increased pain, because I can't think of any direct reason why the Gen 3 would cause someone to have increased pain. I don't have a good answer for you.
Okay, that's a question from Veronica Lawrence. Can these supplements help someone who are forgetful? My mom have problem with short memories.
For sure, because collagen's important to brain function as well. So, there's not a lot of great things out there to reverse the effects of dementia or just in aging, the effects of aging on the brain. But we can take a lot of things to slow it down. And Gen 3 is one of those things. So if you can add collagen to your brain and help with the, help that be more healthy, it just stands to reason that, it's going to help anybody that's already having a little bit of memory deficits or other brain dysfunction. The other things that we have, we talked about, the Live product also is excellent for brain function, and the STM is also excellent for brain function because these are all things that will help preserve, uh, the memory loss and the effects of aging.
Okay, thank you, Dr. Bill. There's a question from Julie Jimmy from Malaysia. How safe is JIFU product for women who are pregnant, postnatal, or breastfeeding?
So the ingredient, everything in the Gen 3 and the Live products are safe for those people who are pregnant or breastfeeding. There's nothing there that would be dangerous to the developing baby. So it is safe, and as you know, when you're pregnant, your nutritional requirements increase, not decrease. So taking a healthy, remembering to take your Gen 3 product in particular would be very helpful.
Thank you, Doctor.
You're welcome.
มีคำถามไหมคะ มีใครจะถามอะไรไหมคะพิมพ์ภาษาไทยก็ได้ค่ะแล้วเดี๋ยวล่ามช่วยกรุณาแปลเป็นภาษาอังกฤษ Any other question? Okay. There's another question from Harry Finney. The father-in-law is half paralyzed due to stroke since 2018. After consuming Live and Gen 3 for like a month, she noticed that his paralyzed hand and leg can move. Wow, that's good news. Can STM help more in his recovery progress? He can start moving.
So the answer is absolutely it can. The best thing on the planet that anybody can do if they have a stroke, traumatic brain injury, dementia, even, autism, are stem cells. So the STM will improve the stem cells that you have in your body. But if you even had the ability to get stem cells, and the plan is to bring stem cells to the platform to JIFU in the near future. But whenever there's really nothing that's more of a miraculous can provide a miraculous improvement to stroke victims than stem cells. So the studies have shown overwhelming significant improvements in things like motor function and cognitive function, numbness and tingling when you've got paralyzed limbs. When we place stem cells into the brain, we can do that through the IV very easily. And so I do encourage anybody that knows anybody, especially if they have family or friends or themselves that suffer a stroke, to try to get stem cell infusions. It's really beneficial for helping with the recovery. And so the Gen 3 product and the Live products, as I mentioned previously, can also support brain function and can help someone that's had a stroke. The STM also, like we were talking about, helps with the stem cells being more active and more plentiful. So that's essential for helping somebody recover from brain injury like stroke. So I'm really thrilled to hear the, the benefits that your family received. But yes, the answer to your question is all three can be excellent for helping any individual with any type of brain injury.
Okay, thank you, Dr. Bill. Question from Amy from Thailand. Is it guaranteed that the pregnant women can take JIFU products?
Yeah, we had that question a little earlier. So it is safe for pregnant women to take the JIFU products, the Gen 3, the Live, the STM, all of that is safe to take during pregnancy.
Okay. And next question is from Mahatana from Thailand. He said, in what level of the kidney problem that will forbid he or her to take Live or Gen 3? Any restriction?
No, not for any kidney problem. It will help support good kidney function, so that's okay. You can take it.
Okay, thank you. From a question from Veronica Lawrence, said a friend consumed Gen 3 for 2 weeks. She said that she gained weight and always hungry. Yeah. So
Well,
what
I
makes her
might.
appetite increase?
All right. Well, there's a good answer for that. Gen 3 will definitely help everything in the body perform better. But one thing it will also do is help your muscles be stronger. Even if you don't work out, your muscles will be a little bit thicker, stronger, bigger. And uh, muscle weighs more than fat. So a lot of times when people are trying to lose weight, they come to see me for different things that I can help them lose weight. And some of those are bioidentical hormones. We have peptides. We have NAD. I have all those things in my medical clinic. And a lot of times people look at the scale after they start these things, and the weight goes up on the scale because muscle weighs more than fat. But if you give it time or look in the mirror, you have to pinch the fat to know how you're doing. Because again, if you look at the scale, it might go up in weight. So if you take collagen for 2 weeks, it's probably muscle weight that you're seeing. And it really should help you lose fat because the more skeletal muscle that you have um, helps you with insulin resistance, or helps you have more insulin available, which means less fat. And so eventually you're going to have less fat, and eventually the number on the scale will also go down. But the first thing you're going to see is, I warn all the patients that the weight might go up on the scale because the muscle weight you put on before you get rid of the fat.
Oh, okay. Thank you, Dr. Bill.
Sure.
Hey, okay. From Julie Jimmy from Malaysia, she experienced using glow cell serum on her mom, chronic skin problem on her feet. It seems to be benefiting her. Is this a known benefit of glow?
Well, it's funny because when it comes to the skin, a lot of people can have different problems with their skin that are not really poorly understood or very difficult to treat. Things like eczema, for example, and psoriasis can happen. And also atypical rashes happen that don't really fit into any one particular category or disease. But the AC11 really has some excellent ingredients that can help heal all those things. We talked about the telomere shortening, which occurs, that we can reverse or slow down with the Glow product. So a lot of things that happen when skin is not healthy, it has to do with telomere shortening also. And so the AC11 is probably improving all those things. I think it was your mother that you said you were using it on, but that's really excellent feedback. I'm happy to hear that. But that there are some very good healing benefits that are present in the Glow skincare line.
Okay. Thank you, Doctor. That's a question from Emmy, Thailand. The sweetness in Gen 3, is there any effect on the blood in the sugar in the blood?
Anything you consume can have effects on the blood sugar to some degree, but obviously things not high in carbohydrates, calories, sugars to begin with are going to cause less of an effect. And Gen 3 is not high in any of those things, so it should have very minimal effect on blood sugars.
Right. Thank you. Okay. Veronica Lawrence, she's a cancer patient, and then she has finished all her treatment. Should she consume all Gen 3, LIF, and STM simultaneously?
Yes, I mean the product line that JIFU now has for longevity um, is they're meant to be used all together. They all serve different functions, and they're all essential to helping people live longer. So we do encourage everybody to use all of the GFU products. I use them all. I encourage them all for my patients and for anybody I meet because they all do. There's some overlap in what they do. For example, the Live and the Gen 3 are both good for brain function, but they're improving that brain function by different mechanisms of action. So the effects are additive. So I would recommend any cancer survivor or anybody at all to take all three of those things just to help you live a lot longer, and it will improve your chances of living longer.
Okay, thank you, Dr. Prit. Is there any last question, please? Anyone? Okay, the last question from Harry is one of the customers says she cannot sleep if taking lift during night. So she had to take lift in the morning. She's not a coffee drinker. So what could possibly happen to her?
Well, the Live has, I mean, there's really nothing in the Live that should specifically keep you more awake like caffeine. However, there's a lot of fruit and berry. There's different blends in the Live product, the super fruits, and some of those do give a little bit of energy. A lot of those same type of extracts are in the Wave product, so it's not supposed to keep you awake at night, and it doesn't usually have that effect, but there must be something in one of those ingredients that is probably stimulating you just a little bit, your brain activity or keeping you awake. But it shouldn't be something that affects everybody, and it's not a common complaint that people have. But there must be something in one of those berry extracts that is probably giving you a little bit more energy and keeping you awake.
Okay, thank you. Thank you for the last question. Thank you, Dr. Bill, for your time. It's
You're
very
welcome.
to all of us, and we love you. We hope to see you more often in the Zoom call, even in person. You're welcome in Thailand, in Asia Pacific.
I would love
Yeah,
it.
thank you very much. It's your early morning, and it's also our night. Thank you.
Well, enjoy the rest of your evening, everybody.
Thank you.
Okay, thank you so
Thank
much,
you.
Dr. Bill. Thank you.
So long.
Thank you.
Yep. Bye.
Bye.